All right, Paul, thank you for that. It's now 9:32, and many of us put off going to the dentist until we just can't put it off anymore. A tooth may break, a filling may fall out, and then we're facing a more complicated, expensive fix. So what do you need to know if the dentist says you need a crown? The Fox Medical Team's Beth Galvin is here to talk about what you can expect. Good morning.
Good morning, Karen. And there are a few things that you probably need to know going into the crown experience. Number one, crowns take a little time, and they usually involve at least a couple of visits to the dentist to get one. And number two, they can be a little pricey, but that brings us to number three. A crown may be your best bet when it comes to a lasting fix.
The dentist says you need a crown, so we'll start at the beginning. What is a crown?
It's like a tooth-shaped helmet. It fits over the tooth and is the strongest and longest-lasting thing to do to a tooth.
Inman Park Dentistry's Dr. Alex Rodriguez says crowns can help repair a broken tooth or one with major decay or a large filling.
Fillings are great, but when they get more than, say, half the size of a tooth, they don't last. And that's what a crown's for. A crown can easily last multiple decades. My dad had a crown for 40 years before I had to have it replaced.
The downside? Commitment. Getting a crown typically requires a couple of dental visits. First, the dentist will drill down your damaged tooth and create a base for the crown, taking an impression that will be used to build the crown.
What we're trying to do with a crown is to get it to fit seamless, where it's no different than your natural tooth. Now, it's almost impossible to do in real life, but that's what we're going for. And the closer we can get it to being seamless, the easier it is for the patient to take care of.
Dr. Rodriguez says they used to use primarily metal or metal-based porcelain crowns.
They didn't look great. The metal showed around the edges. The porcelain could chip.
Now Rodriguez says many dentists are switching to ceramic crowns. Some of them they can design right in their office.
We've got newer ceramics now that are incredibly durable, most durable things we've ever had.
But crowns are not cheap. Ceramic ones range anywhere from about $1,000 to $1,600. But Rodriguez believes that investing in a good crown now will pay off in the long run.
They're better looking than they ever were. They're stronger than they ever were. Honestly, it makes my job a whole lot easier these days.
But you do need to take care of your crown just like you would take care of your natural teeth. So you do want to brush the crown in your teeth a couple of times a day. You do need to floss daily. And Dr. Rodriguez recommends rinsing your mouth with a fluoride rinse at least once a day. And once you get that crown, you should be pretty good to go and not need a whole lot of follow-up visits or have any complications beyond, coming in for your yearly checkup, which is always recommended, Karen.
But Dr. Rodriguez even said himself, his father, for decades, he had a crown in his mouth. Does that mean they don't fall off, or can they fall out?
It doesn't mean they don't fall off. It's pretty rare for them to fall off. He believes that when a crown falls off, it's kind of a mixed blessing, or it's a blessing in disguise, because maybe there's decay in there, or there's some reason, some structural reason that the crown's not working, and so you don't want to keep it in there. But you can get it, fixed if it does fall off.
That makes sense. And I'll tell you, the reason a lot of people don't go to the dentist is because the pain associated with going to the dentist.
Yeah.
Is there a lot of pain associated with the crown?
So I would say there is some pain, but they numb your mouth, and it's very similar, Dr. Rodriguez says, to when you get a filling. So they give you an injection of lidocaine to numb the mouth, and so generally you may feel vibration, or you might feel, some of the tools, but you're not going to feel serious pain.
Okay, good stuff as always.
Thanks,
Thank you for that.